Hello and welcome to Connect MKE. I'm your host, Denise Calloway. It kills more people in Milwaukee County than homicide, suicide, and car accidents combined. Fatal opioid overdoses are ravaging parts of Milwaukee County. Recently, in just one 72-hour period, there were 17 fatal overdoses. 17. That compares to the already tragic normal fatal overdose rate of one death every 16 hours. How can we stop Milwaukee County's opioid epidemic? And can more lives be saved? Are there enough programs to help those who are seeking treatment? We'll examine those questions with our guest today. Joining me first is Dr. Ben Weston, Milwaukee County's Chief Health Policy Advisor. Welcome, Dr. Weston.
Thank you for having me.
How would you describe the opioid epidemic in Milwaukee County?
Well, I think there's a few important things to know about our opioid epidemic. I think the first thing that's important to know is we're still, unfortunately, setting records. We had 548 opioid-related deaths in 2021. That was a record in and of itself. In 22, we have 521, but we still have almost 60 still pending. So we'll see likely another record year. So really, the numbers are staggering. And the other thing that's really important to note is the rapid nature of which fentanyl has really taken over the drug supply in Milwaukee County, from being just about 50% of opioid-related deaths a few years ago to 100% so far this year. That's new data in just this week. 100% so far in 2023 of overdose-related deaths have contained fentanyl, and we saw 95% last year. So just staggering, incredible numbers that we're seeing here.
So we see fentanyl playing a bigger role in those overdose deaths. What role does fentanyl play in the increase in the number of deaths because of the impact that fentanyl has on the body?
So fentanyl is 50 to 100 times stronger than morphine, for example. It's a synthetic opioid, so it's created in a lab. Now, fentanyl's easy to produce, it's cheap, and very small quantities. We're talking the tip of a pen is enough to cause an overdose. And so, as you can imagine, it's easy to transport. It's easy to mix into a drug supply. That makes it very attractive, unfortunately, for the folks who are distributing these drugs. But it also makes it incredibly dangerous for the users. And that's why we're seeing so many more deaths. Big part of the reason why we're seeing so many more deaths in Milwaukee County and nationally as well.
Is Milwaukee any different from what other communities in Wisconsin are experiencing, both in the increase in the number of overdoses, as well as the increase of the impact that fentanyl is having?
Sure. I mean, we're seeing similar situation throughout Wisconsin. We're seeing increases in opioid-related deaths. We're seeing increases in fentanyl-related deaths. Now, of course, Milwaukee County contains 1/6 of Wisconsin's population. And so just based on that, and we have much more diversity than Wisconsin in general. So just based on that, the impact to Milwaukee County on the scale of Wisconsin more generally is really quite something.
Who is dying from opioid overdoses in Milwaukee County?
Well, I think it's a really important question, and I think it's a little bit of a nuanced question, because who is dying? The answer is everyone and anyone. I'll tell you, after we had those overdose deaths in Milwaukee County, in the day after, I heard the word junkie a lot. People would say, "Oh, those poor junkies," or "Oh, those junkies overdosing. I don't know why they're doing that." These folks that overdosed, and the folks that have been overdosing for years and years, I don't know what junkie means, but these people have families, they have careers, some of them own businesses, their parents, their brothers, their sisters. These are people like you and me, and they're men, they're women, they're old, they're young, they're Black, they're white, Hispanic. I mean, across the spectrum of Milwaukee County, we're seeing these deaths. And that's not different from other communities as well. It's hard to stigmatize this population because it is so broad.
But it really points to the fact that there's really no part of our community that is untouched by the impact of the opioid epidemic and these fatal overdoses.
That's right. You know, for a variety of societal factors, opioid-related deaths have in the past in the past been overwhelmingly seen in the white community. Now, over the last few years, however, that's changed. So, for example, if we look at 2021 compared to 2020, that was really a turning point. Year over year, opioid deaths among African Americans in our community increased at a rate 9 times that of whites. Now, that's a dramatic and striking increase, but it speaks to the changing landscape in the approach to opioid use disorder in our community, but also to the way we target our interventions.
Let's talk a little bit about those interventions and those efforts to begin to get this under control and support people who need help. You described Milwaukee County's approach to the opioid crisis as something that is multifaceted with upstream and downstream approaches. Help us understand what that means. What does it mean when you say there are upstream approaches?
So anytime we look at any health issue, we want to think from a public health perspective, upstream and downstream. So upstream is preventing it before it even occurs. So in the case of opioid overdoses, but really in the case of just about any health problem, this is upstream. That upstream approach is about focusing on social determinants of health. So these are things like housing stability, access to healthcare, prevention of disease, other social and mental health supports that really make a difference for the long-term health of somebody. And it's not just opioids, it's gun violence, it's reckless driving, it's also diabetes, it's heart disease, it's cancer. All these different areas are affected by these upstream factors. So certainly that's an important way to think about these, but it also is a very long-term way. Investing in upstream is critical, but you don't really see the trickle down from that for years to come. So that's why downstream is important as well.
Tell us about some of those downstream or more immediate efforts that are underway to address the issue.
So in Milwaukee County, we have a lot going on upstream, but we also have a lot going on downstream. This has been really punctuated lately by the county executive signing a bill to release $11 million in opioid settlement funding for several different projects. Now, we've been working in the opioid and substance use space for a long time, but this is really a jumpstart to a lot of those projects. So, for example, one notable project focuses on harm reduction. Now, harm reduction a few years ago was a bad word. Harm reduction means understanding that there are people out there that are going to use opioids, but there are tools we can put in place to prevent them from overdosing and give them the opportunity for recovery. So harm reduction, evidence shows, is really critical to overcoming opioid use and substance use more broadly in the community. So we are unrolling these harm reduction vending machines. We just placed the first one. We're eventually going to roll out 25 across the county. And this is guided from data from our public-facing opioid overdose dashboard. So these vending machines include things like naloxone, the antidote to overdose, the nasal spray, fentanyl test strips, critical in our community with close to 100% of fatal overdoses containing fentanyl, medication storage bags, medication decontamination bags, things like this. And these are free. You just walk up, you push the button, you get it, and you walk away. No questions asked. Now, some of these programs also are focusing on other ways to get harm reduction kits out there. So we work with our fire departments. You can knock on the door of an ambulance, you can knock on the door of a fire station, and you can get one of these sort of kits as well. Our law enforcement are handing them out. Our sheriff's department is handing them out. So making this available helps folks to, if they're going to use more safely, but also move towards steps to recovery.
How do you get the word out about the fact that these kits, these harm reduction opportunities, are available for people? Because I'm guessing that some of the traditional sources and mechanisms that you use don't necessarily work when we're dealing with someone who has an addiction.
Well, here's one of the ways. Talking to you, talking about what's available in Milwaukee County, over social media, through our community organizations, through people who are out there and interacting with the community, talking to them about what's going on, but also I think it's important to note placing these harm reduction kits strategically. We're not putting these vending machines in parts of the county where there's no overdoses going on. We're putting them in areas where you have a vulnerable community combined with a high number of overdoses. And I think we'll see what the data shows, but I think those are going to be the most effective placements for these vending machines or for these harm reduction kits. And that's one example of what Milwaukee County is doing in the downstream space. There's many other examples as well.
Well, tell us about a few of those other examples that you're engaged in.
Sure. So one area that Milwaukee County is deeply engaged in is what's called medication-assisted treatment. Now, historically, we'd think of this as like methadone. So it's a treatment that is long-term and helps people overcome that urge to use opioids. Think of it as if you quit smoking. If you just quit cold turkey, it's pretty hard, and data shows that not many people are able to stick to that. But if you quit with a medication, if you quit with, a tobacco chewing gum, if you quit with, other mechanisms that help you kind of wean off, you're much more likely to be successful. And it's same with medication-assisted treatment. Now, methadone is still around. It's a little bit of an older drug, but there's things like buprenorphine, another medication that's oral. You can just take it every day. It's extremely safe. And we've been working on getting folks into these medication-assisted treatment programs. Two specific areas we're targeting. One is incarcerated populations. We see that when folks are released from incarceration, it's one of the most dangerous times for overdose. And so if we can connect them up with this medication-assisted treatment, you decrease the cravings, and you also minimize the possibility for overdose, even if they do take opioids on top of that. So that's a critical time period. We're also just this week, through the Milwaukee County Office of Emergency Management, we're working with our EMS agencies, our fire departments in Milwaukee County, to allow them to start these medications in the field. Somebody calls 911, they're seen by our paramedic units. And even if they don't want to go to the hospital, we can give them this medication in the field, get them feeling better, help with those withdrawal symptoms, and decrease the likelihood for overdose in the future.
When you look at where we are right now with the opioid addiction, opioid overdose issue that we're facing in Milwaukee County, have we reached a tipping point? You said that this year or 2022 is likely to be another record year. Have we reached that top, and we're now beginning to look at hopefully decreasing the number of deaths due to opioid overdose?
Well, certainly we look to decrease the number of deaths, and we're pouring resources into this, again, upstream and downstream, to try to change this. But, you said at the top of the show, 17 overdoses in 72 hours. That's an untenable number for Milwaukee County. And it, I think, shows that we haven't turned a corner yet, and that these programs are critical. And the work that the county is doing, the work that our community partners, our public health agencies, our fire departments, law enforcement are doing is critical to help move this forward and turn those numbers around.
What can we do as everyday citizens to play a role in expanding or amplifying the work that's being done?
That's a great question. I think one of the things to understand is what we touched on a little bit about before, is how common this is and how it's among all populations. Just about anybody out there, somebody in your circle, your families, your friends, your coworkers, somebody is at risk for overdose. And so keep that in mind. It's not just this, distant idea of somebody out there who you've never met who's overdosing. These are people who are living their lives. They're living lives just like you and me, and they overdose. It might be the first time they ever try something, or it might be the 100th time. But at some point it happens, and it's folks within our circles where it's happening. And for viewers out there, it's folks within your circles where this is happening. And so I think understanding that, reaching out to folks who you think might be at risk, if you own a business, if you're at a school, if you're at a religious institution, a store, whatever it is, having a naloxone nasal spray available. A lot of these overdoses are not occurring in the privacy of the home. They're occurring in the bathrooms of a business or behind a gas station or whatever it is, or in a parked car. These are the places where it's occurring. And so having the resources available, having the knowledge of who's overdosing, which is everybody, and reaching out to folks around you is critical.
Thank you, Dr. Weston, for the work that you and other folks in Milwaukee County are doing to address this issue that is devastating to all of our communities. Getting people addicted to opioids into treatment programs that work is an important part of the long-term solution to addressing the opioid issue. Coming up, we'll hear from the head of one local organization who is working to do that every day.